morning. My name is Carrie Drolet, and this is Connecting Seniors San Diego. Today we are here with Christina Marquez, the president of the San Diego Coalition for Compassionate Care, whose focus is on improving the life for people that are experiencing serious chronic illness and having those important end-of-life conversations. Thank you so much for joining us today.
Thank you for having me today.
Thank you. Please tell us about the San Diego Coalition for Compassionate Care, what you guys stand for, what your vision is.
Great. So our goal is that all San Diegans that are facing chronic illness or serious disease have the opportunity to have a good quality of life, have end-of-life conversations, normalize end-of-life conversations, have those conversations with their loved ones so there's full meaning in what they want and we can honor those wishes at the end of their life.
Christina, what is advanced care planning and why is it so important to have that?
So advanced care planning is, we plan everything in our lives. So we plan where we're going to go to college, our kids, buying our first new home, retirement, all of that. But we don't ever have those conversations about if I want to stay home, what that actually looks like as I enter the end of my life. So advanced care planning is just that conversation. It's planning across the whole spectrum, the whole continuum, realizing that 1 in 4 people or 1 in 2 people are going to need care at the end of their lives. And it's very expensive to do in-home care or go to assisted living, and planning for that and planning for their future. So if the goal is to stay home, what does that look like and how do we accomplish that mission?
Gotcha. And what is the difference between advanced care planning and palliative care?
So palliative care is, advanced care planning is having those conversations, understanding, putting a plan in place, doing a durable power of attorney for healthcare. So finding an advocate for you that you say, these are my wishes, this is what I want at the end of my life. Sitting down, breaking bread with that person and making sure that person's going to honor your wishes through it. So if you understand that maybe you never want to be on life support or you don't want a feeding tube at the end of your life, it's finding that person's going to honor those wishes, but it's also having those conversations about, would I want to live like this? Would I want to live in bed? For me, I always say, if I can't go out, enjoy the laughter of my children or my grandchildren or have lunch with a friend, that's not quality of life to me personally. So it's helping people to understand what quality of life looks like and what they want their end of life to look like. And then having an advocate that's going to honor those wishes. So that's a durable power of attorney for healthcare. That is a form, it's a legal form that you can sign where you actually designate an agent to make those decisions for you if you're unable yourself. The next thing is we have hospice and palliative care, and a lot of people get very confused about what hospice and palliative care is. Palliative care is comfort care focus with anyone that has a chronic disease. So you have your regular insurance, but the goal is symptom management, comfort focused treatment, and making sure that you are living the best quality of life with that chronic disease. Hospice and palliative have the same goals. The major difference is hospice then actually takes over your care. So hospice, the team comes home, wherever that may be for you. You no longer go out to get those services. The team comes to you with the understanding that that's going to be through the end of your life. So palliative, you're still going out, seeing all your specialists, getting that treatment with that chronic disease. Hospice is saying, okay, I understand that I have a life-limiting illness, usually within 6 months or less, so I'm gonna stop going out to the hospital or the skilled nursing or to my specialist and get the care at home.
Now, Christina, a lot of times when people hear the word hospice, that's a very scary word, right? There's a misconception that maybe that their loved one's going to die immediately. Can you explain that a little bit for us?
Sure. When I go meet with my families that have broached the topic of hospice, I ask them those 2 questions. Usually it's, have you had a good experience with hospice? Have you ever had an experience with hospice? And I hear that a lot of times. Oh, my neighbor went on hospice and they died within 3 days. And so what I tell my families and my patient is that person would have passed away anyways. That hospice came on way too late. That person was probably already imminent at the very end of their life. Hospice is actually best for people that we are looking at, maybe have been in and out of the hospital multiple times, we're seeing weight loss, that sort of thing. And I never hear my patients say, I want to die. I hear my patients say, I'm really tired. I don't want to do this anymore, which means they don't want to go from home to the hospital to the skilled nursing back to home. It's kind of a loop that they do. And so what I say is, fine, we're going to honor those wishes. This is what it's going to look like. Instead of saying we're giving up or doing something like that, we're changing the plan of care. So we're going from life prolonging to quality of life. So we're looking at keeping you home, surrounded by your loved ones. I tell my families all the time, we're gonna just come love on you. We're gonna make sure you get all the care you need at the home. We're gonna make sure that if you have a UTI or if you get pneumonia, we're gonna treat that most of the time if it makes sense, but we're gonna remove anything invasive. So we're not gonna do IVs, unless it's warranted. We're not gonna do anything if someone's been on a really restricted diet before hospice. We're like, let them have the ice cream. It's okay. If they want a glass of wine at night, let them have it, because we're really looking at true quality of life through that person's end of life. So hospice is scary, but it's really a support system for people. And I love to normalize death. We don't talk about it as a society. We're all going to be there. I'm going to pass away someday. You're going to pass away someday. Our children are going to pass away someday. There's 100% chance that any of us are not getting out of here alive. And so my job is to normalize the conversations around death and make sure it's not a scary topic and really understand what that looks like. So it's really changing quality of care, helping them to live a better life with their loved ones versus in and out of the hospital through the end of their life.
Now tell us about some of the programs, and educational pieces that you guys offer through the San Diego Coalition for Compassionate Care.
Yeah, absolutely. So we have a training on advanced care planning where we really go out into the community and talk about what is advanced care planning, how do you set it up. We also do what we call our Pulse training once a month, and that's, we call it the pink form. It's the physician's order for life-sustaining treatment. And it is a standard across California that, it's a standardized form across California, and it's a physician's order for if somebody wants CPR, if they don't, if they want tube feeding, life prolonging measures. And it's a guided form that we go over. It's kind of the standard in palliative care that people have that. And so we train professionals on how to have the pulse conversation. So it's not just a checkbox form, but it's actually a guided conversation. So people are well informed about what it means to be full code or to be a DNR. What does a medically appropriate do not resuscitate mean? Why do we have that terminology? Does it make sense for someone to have DNR at the very end of their life? So we do a lot of training on that as well.
Wonderful. And what's the best way for someone to get a hold of you?
The best way to get a hold of me is actually to go to our SDCC website. Tell everybody just Google the San Diego Coalition for Compassionate Care. You go on there, you can sign up for our Pulse trainings. You can also become a member if you're just interested in kind of what we're about. We have a guest speaker every month. You can hop on the Zoom link and join one of our meetings. They're usually pretty small and intimate. We've been on Zoom up to this point, but I'm excited to say in May that we're actually going to go back to in-person meetings. It's going to be more of a networking type, bringing guest speakers in the Escondido area. So more to come on that.
Wonderful. Well, thank you so much for what you do.
Thank you. Some other exciting things that we're doing among the coalition is we have a very robust education committee, and we are really working with the Mexican consulate to get conversations in English and Spanish and really touch that underserved population so they are fully informed of their healthcare decisions. And we've done some amazing work. We've also worked with the PACE programs to educate our families in the PACE programs to make sure they're making good medical decisions through the end of life as well.
Wonderful. Thanks so much for joining us. We really appreciate your service to seniors. If you would like more information on the San Diego Coalition for Compassionate Care, please contact Christina Marquez at the number below. Thanks again for joining us, and stay safe, San Diego.
Thank you.